All right, everybody, it is just past the hour, so I think I'm going to go ahead and get this thing started. For those of you who do not know me, my name is Brenna Leftwich. I am an academic and industry relations manager for Aspen Dental Management, Inc., also known as ADMI. I have been with the company about 2.5 years now. I work with the dental schools and dental hygiene schools from the Midwest to the West Coast on our academics team here with Aspen. As you can see, I'm joined with three wonderful panelists. I'm going to have them introduce themselves here in a moment. First, I just want to let you guys know that we do have all the questions that you guys have submitted in advance. I have them on a screen over here to my right, so if you guys see me kind of going back and forth here, I promise I'm paying attention. I don't have anything more exciting going on this screen. Just have all your questions kind of organized, put some of the duplicates together. I just want to make sure we get through this as efficiently as possible and answer everybody's questions. We also have a live Q&A here at the bottom of your screen. You can submit questions anonymously if you would like to do so, but you do have that option. I think that is about all I have for you guys. So with that being said, I think I'm going to go ahead and have our panelists introduce themselves. Jennifer, would you like to go first?
Sure, thank you. My name is Jennifer Cobalt. I'm currently a lead dental hygienist for Aspen Dental in Evergreen Park. Today is actually my 1-year anniversary with Aspen, and it's been an amazing year. I have been a dental hygienist for 12 years. I previously worked in private practice for those first 11 years. And this past year in Aspen has been amazing, and I could not be happier with my switch to go from private practice to Aspen.
Mm-hmm. And Abby, what about you?
I am the lead dental hygienist in Champaign, Illinois. I started out with Aspen about 2.5 years ago, just a fresh grad out of school, and did some dental assisting, and I have transitioned into a hygienist. I did some hygiene floating around in many different offices for coverage. I then settled in Champaign, Illinois as the associate hygienist, where I later grew to be the lead hygienist. And I really love Aspen. I love everything that it has to offer and all of the connection and people you meet. So there's really a lot of opportunity for growth.
Awesome, thank you. And Kendra, what about you?
I am a dental hygienist as well. I'm coming up on my 14th anniversary of being a dental hygienist, but my 4-year anniversary at Aspen. I started out like these ladies as a clinical hygienist. I then moved into a territory manager of hygiene support position, and now I'm the division director of hygiene support, currently supporting Tennessee, Indiana, Kentucky, and Illinois. So happy to be here with you guys tonight.
Awesome. And again, thank you so much for joining us, panelists and attendees as well. As you can see, we have three hygienists, but also one of them is a territory director. So we can provide a couple different perspectives from the office. Again, this is an Ask Me Anything session, guys. So feel free to ask us anything, the easy questions, the hard questions. That's what we're here for. And we are going to give you our best and honest answers and get through as many questions as we can. So I think I'm going to go ahead and start us off here with some of the questions that you guys have submitted in advance. And again, please feel free to throw anything in the live Q&A as we are going along. So we are going to start us out with a nice broad question here. Why did you choose Aspen Dental? So I know we answered a little bit of this within our introductions and our background, but did you start with Aspen Dental? Have you ever worked for another DSO or a private practice? And if you did start with Aspen, did you ever look into other options and interview anywhere else? So Abby, would you like to start us off here?
Sure. So honestly, I didn't know a lot about Aspen Dental whenever I first got started. I knew that I'd seen a lot of different locations in different, towns and things like that. So I kind of understood that they were a brand and that there was, many different offices operating under the name Aspen Dental. And I kind of liked that idea. So I started off as a dental assistant. Like I said, there was a dental assisting position open, and I really just needed a place to give me a chance and an opportunity to kind of start. I was a fresh grad out of school, didn't have my hygiene license yet, and I really wanted a foot in the door somewhere to kind of see what it was like working in the dental field and kind of, get some experience under my belt. And to be honest, Aspen was really one of the only places that was offering opportunities. There was not a lot of options where I was. You know, a lot of offices were pretty fully staffed, and Aspen really gave me that opportunity to get started. And I never went anywhere else or looked into anything else beyond that. So.
Oh, I love that. And Jennifer, what about you?
The reason I came to Aspen was really the opportunity that I realized existed outside of the operatory for hygienists. I, like Abby, saw Aspens everywhere, but again, I was in private practice for a very long time. I just knew that I was ready to move on and grow my career. I felt very stuck in my private practice. There's not room for hygienists to do much more than that. And I've been doing it for such a long time, and I still enjoy it. And here I am still in the operatory, even though I planned on coming to Aspen and trying to move out of the operatory, which hopefully will happen, but I'm enjoying what I'm doing. I didn't know what it was going to be like for me in the operatory. So that's really what drew my attention, was the opportunity for growth. And here I am.
Yeah, and the opportunity for growth is definitely there, and it's something that we will get into a little bit more into this Q&A. I know that is a question and a topic that comes up a lot on these, so we'll definitely get to that. So I'm glad you brought it up. But Kendra, do you want to talk about how you ended up with Aspen?
Sure. My story was a little bit different. I was a mom with 2 kids, and I needed the benefits. So I am married, but my husband's self-employed, and I worked in private practice for many years, but it just came a point in time when that became a huge burden for our family, and we needed to make a change. So I didn't have an Aspen close to me, and I was willing to commute, and obviously my career path took a huge change. So I'm super grateful every day for the opportunity that came along.
Awesome. So we did bring up the term DSO a little bit, and before we get a little bit further into this, I do want to elaborate a bit on what that is. So I think, Kendra, I'm going to have you take this one. Would you like to explain to everybody what a DSO is?
Sure. I often, when I do school visits, and I get to do a lot of visits with students, the question comes up around corporate dentistry versus a DSO. And the biggest difference between corporate dentistry and a DSO is the fact that our doctors own our practices. You see them, they're working within the practice. That's their baby, just like it is within a private practice. The best part about it is, though, is dentists get to be dentists this way. We're on the back end helping with payroll, human resources, CE opportunities, all of those things, leadership development. So it's not just about dentistry. That way the doctor gets to do their thing, and they've got the support team on the back end that helps them out.
Mm-hmm. Yeah, I mean, I definitely think that's a great thing to bring up. I do a lot of school visits as well. And, you know, you always hear the word corporate, and I always like to say, you know, it's not corporate. We don't own the offices. Our doctors own the offices. So I really like to bring that up. So I'm glad that you touched on that for everybody. So we're going to move on to our next question here. And that is, how would you differentiate Aspen Dental from other DSOs or dental service organizations and private practice? Jennifer, do you have anything for that?
Yeah, Aspen's actually my first experience with a DSO, and I honestly didn't have a preconceived notion about DSOs. But private practice, I definitely knew what it was about. And the greatest thing I think up to this point is the amount of support I feel as though I have. Sometimes, especially in private practice, if you are in a scenario where your relationship with your dentist just isn't great, you can actually find yourself in scenarios where your career, which you take very seriously, can be belittled, if you will. So I really appreciate all of the people I have around me to reach out to for questions or advice or whatever I need as far as my career and just continuing to practice the way that I know is ethical and right. that's probably the biggest difference.
Abby, what about you? Do you have anything to add to that?
I don't have the same experience because I didn't have any prior experience before coming to Aspen. I obviously, when I was in school, had experience, observing and private practices and things like that. And I would agree with Jennifer that when you work for Aspen, you do feel like you have kind of you're empowered in your career as a hygienist, and you do have a lot of support. If you need anything, if you need any type of training, if you have questions, if you're having problems, you do have that support that is needed. And I know there's, a lot of issues sometimes in private practice where if you only have your doctor to go to as, the person who's running the business, or the office manager who's, sometimes is a close personal friend of the dentist, or things like that. With here, you do have a lot of people you can reach out to. You have, your regional managers and your hygiene territory support managers, and you have other hygienists that you can go to. So I think really a lot of it is just about the support that's there in comparison to a private practice. So that's what I really like.
Thank you. And Kendra, I mean, as a territory director, you obviously work with a lot of different hygienists with a lot of different backgrounds. So do you have anything you want to add to that? I mean, you've worked with dentists or hygienists who come from private practice and other DSOs. So, I mean, I'm sure you've heard a lot of different perspectives. So do you have anything to kind of add on to what everyone said?
I think the biggest thing for me is just the structure of things. I just love, having the systems and the things in place that help keep us all aligned in what we're all working toward. Sometimes in either other organizations or private practice, the message isn't clear and aligned like it is. And I feel like from California to Maine, we all know what we're working toward and we're all doing it together.
Yeah, I mean, from the management side, working for ADMI as well, that's definitely something that I would agree with. So moving on to our next question here, we will go to, what is the clinical autonomy like in the office as a hygienist? Abby, would you like to start us off?
Yeah, so as a hygienist, I mean, you really do run it like your own business. You have full control over your hygiene schedules that you kind of set up to fit within your clinical guidelines. So you have the opportunity to treatment plan your patients coming in as a new patient, or just prior to that day, getting to set up, x-rays and perio charts, and any type of adjunctive therapy that's needed for that patient. You are in control of kind of setting up the treatment prior to their appointment. You have, like I said, the opportunity to set up your hygiene schedules. So however long you need for your appointments, how many exams you want to see in a day, things like that, you really have control over. And you really work closely with your dentist, who helps you within the guidelines of, his clinical guidelines. So really working together, it's more of a partnership rather than somebody telling you what you're doing. You really get to kind of step up to the plate with the dentist and set up those clinical guidelines and together, and then you get to kind of run it as your own beyond that.
And Jennifer, what about the clinical autonomy for you within your practice?
Yeah, I completely agree with everything Abby said. Just to further that a little bit, because I came from private practice, I found myself in scenarios regularly where I was given patients doctors had already diagnosed, and I was finding myself having to have difficult conversations with dentists explaining, hey, this isn't a preventative prophy, this is a patient with periodontal disease. And those communications can be difficult to have. Sometimes they work out fine and sometimes they don't. So the fact that we do have clinical autonomy in that way, we are able to write our treatment plan for our patient. And of course, the doctor follows through. It is a partnership, absolutely. But just being able to have that first access to a patient before it's thrown onto your schedule, if you will, is amazing.
Mhm. And so Kendra, as far as clinical autonomy, you oversee and support some of the hygienists. So do you have anything you would like to add to that?
So I'm here on the back end to help with those conversations, like Jennifer had mentioned earlier. Sometimes clinicians don't always see eye to eye, and they need help understanding where the other one's perspective is coming from. So we're there to help out if those conversations do arise around that. Also, we're there from the clinical support side of things to help with CE opportunities and the latest and greatest within our profession itself. It's part of my job to make sure all of my hygienists are in the know about what's going on within our profession itself.
Mm-hmm. And again, I mean, if you're working for, let's say, like a private practice, you don't have someone like, let's say, a Kendra who oversees the hygienist to be there to support you. So that kind of goes into what all three of these panelists said. And this kind of ties into the clinical autonomy, another question right here. And this is one of my favorite questions to get during lunch and learns. People always want to know if you guys have quotas that you need to meet within the practice. Jennifer, would you like to start this one? Do you have quotas in your practice?
I would love to take that question. No, there are no quotas in our practice.
Mm-hmm.
One of the really nice things that I appreciate that Aspen does is we have access to our metrics, and that allows us to see how we're doing, how much care we are able to provide for patients, and it provides a gauge for you to know where you're at in your business. But there is absolutely no pressure on you, no quotas. It just really allows you to, again, ethically treat patients and provide the care that they need.
Mm-hmm. And what about you, Abby?
Yes, like Jennifer said, the metric system is fantastic because it's really a measure of behaviors, and you can really see, how am I doing? Am I really treatment planning accurately? Am I allowing access to care to my new patients? That's really a measure of behavior the metric system is set up for, and I monitor it religiously to help me see if I'm doing my best, and also to help me see, am I running my hygiene business as successfully as I can?
Mm-hmm. Yeah, and I mean, that's something great to touch on. Like, it is your hygiene business. Like, that is the definition of clinical autonomy right there. Kendra, again, overseeing and supporting a lot of hygienists. Do you have anything to add on that?
I'm going to leave that one as is. They both speak beautifully about that.
Yes, so Kendra does not provide any quotas for her hygienists. So now moving on, I think we're going to get in a little bit more of the office structure. So somebody wants to know how many dental assistants work in your office, and do they only work for the dentist, or do you guys have dental assistants as well? Abby, would you like to start?
My office has approximately 4 to 5 dental assistants. We have one who's kind of part-time. I do not have hygiene assistants specifically for me. I am a double hygiene office, which tends to work really well because we kind of work with each other in making sure that whatever support we need is taken care of. We help clean each other's rooms. We help to periochart, take x-rays, whatever we need really helps in a double hygiene office. However, the dental assistants are there, and understand the expectation is that they help everyone. We all help everyone and work as a team. So if needed, I can always have access to a dental assistant to help me with a periochart or whatever I may need to. So there is no specific dental hygiene assistant in my office, but I think that other Aspens do have things set up that way, which is also really a great option if you're not a double hygiene office.
Mm-hmm. And Jennifer, what about your office?
We have 4 to 5 assistants regularly. I opened a brand new office, and we opened single doctor, single hygienist, and there were 4 assistants, and I had a ton of help. No hygiene assistant per se, but exactly what Abby said, we were a team. Anything I needed or they needed, we helped each other out. I can even go a little bit further. Actually, in private practice, I had an assistant, and it worked out well for a little while for me. But because I was trying to run a business, that actually didn't work well for me in private practice any longer. So I was excited. That's part of the reason I left private practice, was to come to Aspen and be able to run my own business. And to go even further into that, because I was able to do that, we actually became a double hygiene office within 5 months of opening, because we grew our business so much and the opportunity was there. So now we are a double hygiene office, and there's 2 hygienists and we still help each other. The assistants still help us. I mean, it's just a very nice flow.
Mm-hmm. So we did have a follow-up question asking how many hygienists were in each office, which I think both of you mentioned that you both have 2 hygienists within your practice. So Kendra, do you want to talk a little bit how they can differ with how many hygienists are in the practice?
Sure. A lot of offices in our original model, as Aspen Dental has grown across the nation, did start out with primarily 1 hygienist. But with our brand promise to access to care and the increase in recare patients, along with the demand with new patients, we have moved to the double hygiene model in most offices. Not to mention, I come from a background where I always had another hygienist there. It's nice for that camaraderie and to be able to compare treatment plans and thoughts and what you would do. So we recognize that and we've moved toward that model.
Mm-hmm. And I think that kind of ties into what we mentioned earlier about how all of our offices are individually owned by the doctors. So every office is going to be a little bit different depending on the owner and depending on the patient flow. So, some will get to the point where they need 2 hygienists. Some, maybe the new offices that we opened aren't quite there yet. So again, it's one of those that's really going to depend on the practice that you're in. We did have another follow-up question asking if any of the hygienists were part-time. Kendra, do you want to touch on that again?
Sure, I can take that one. Yeah, we have become really flexible with our opportunities. We have opportunities for full-time, part-time, especially with the addition of double hygiene. A lot of our offices are open more than 40 hours a week, and we want to be able to cover those to provide care for our patients while still allowing for work-life balance and all of those things. So yes, we have opportunity for full-time, part-time, and we even have some hygienists who just fill in here and there for us when they can. So all of those are available.
Yeah, I think I've even heard a little bit of a running joke that there's like 1.5 hygienists in every office, like 1 full-time, 1 part-time, a couple part-time, anything like that. So if they're for people listening, if you are interested in part-time opportunities, that's definitely something we will discuss and get into per office basis, and if there's options or opportunities for a part-time hygienist. So I'd love to discuss that with anybody. And so while we're on the topic of offices, what are the hours like in each office for you as the hygienist? Jennifer, would you like to start us off?
Sure. So our office is open 40 hours a week, and I do work close to that each week. The biggest thing with Aspen is that we break down barriers to care. And so we try to be available as much as possible to treat patients in need. And we have a lot of patients in need. The best thing about that scenario, though, is I believe this is an Aspen model. It definitely is in my area, as our Fridays are half days. So we work 8 to 1, and it's very rare that we work a Saturday. I'm currently at the point in my career where if my office is open on Saturdays, I'm not working that Saturday. So that's really great to have my weekends free.
Mm-hmm. And what about you, Abby?
Similar to Jennifer, we are open 40 hours a week. We did at one point in time operate on an 8 to 8 schedule where we would alternate, early days and late days and things like that around our office. After COVID, we kind of scaled back a little bit and kind of restructured our office just for a lot of reasons, but we are now more on a traditional 40-hour-a-week schedule. We do have half days on Fridays, and we operate Saturdays 1 day a month, which are only about from 8 to 12. And since we are a double hygiene office, a lot of times how we'll operate is we will alternate Fridays, alternate Saturdays. So you get a 3-day weekend every other week and things like that. So it works out really well with, trading and coverage, however needed, if you need a day off for a wedding or whatever it may be.
Mm-hmm. Oh, that's awesome. A 3-day weekend must be nice. I don't get those with my job. Kendra, do you have anything to add with overseeing a lot of the hygienists and the practices as far as the hours go?
No, the only thing I would add is that in most offices, we do offer usually a late day once a week. That's again in line with the breaking down barriers to care. We know that a lot of our patients are working class and need those late hours. So we do that in many of the offices. Like Abby said, especially in double hygiene offices, they tend to rotate those so not one person is stuck doing it. But in this time where sometimes it is easier if there's a spouse at home and there's kids to deal with and that sort of thing, having that opportunity to be able to work different hours than just your normal 8 to 5 is an advantage for a lot of hygienists right now. So we're finding ourselves trying to be more flexible for both our patients and our employees right now.
Awesome, thank you. So our next question here is, how does the treatment planning go within the offices? So I think that can kind of tie in if you want to elaborate on the relationship that you guys have with your doctor. So if you guys want to take that and talk about the treatment planning. Abby, would you like to start?
Yeah, so Aspen has structured a new patient column specifically for patients who are in pain, patients who need to get back into their, dental care, have maybe not been seen by a dentist in 20 years or however long, sometimes never. And that's really an opportunity where we as hygienists and doctors can kind of partner and work on our treatment planning. So every new patient, we review their x-rays, review their clinical needs, and kind of get to establish before the doctor even comes into the room what their hygiene treatment is going to be looking like, where the need lies. And we get the opportunity to go through our patient education and discuss our findings with the new patient before doctor even comes into the room. And kind of how that partnership looks is that the doctor comes into the room and we kind of get a chance to explain our findings to the doctor and explain our treatment plan. And my doctor is great, always full support of hygiene, always kind of backs up my treatment plans, and it re-explains to the patient in full explanation on how they are looking as far as a perio standpoint, what their gums are looking like, and make sure that they also reiterate the importance of their hygiene.
Mm-hmm. And Jennifer, what about you?
Our office runs up the same model as far as a new patient coming in. Most oftentimes, the assistants are the one to take the x-rays, and then as the hygienist, I start out my exam and I have time to properly diagnose and explain to the patient exactly what they need. I show the patient their x-rays. We walk through them together. We actually also have, our office currently has an iTero scanner, which is an amazing piece of technology as far as patient education goes. So we always do a health scan for all new patients, and that gives us an extra piece of technology to show to the patient. And then I am able to write my own treatment plan for hygiene. And then, of course, we do a handoff to doc, and I explain to doc exactly what I have found. And I find that opportunity for me to touch base with the patient first opens the door a lot of times for them to understand exactly what the doctor is going to say or whatever they may be in need of, because it gives us the opportunity to touch upon obviously the hygiene, but anything else we may see, we can point it out to them and just, kind of lead them in the direction so they know somewhat what to expect when doc comes in. And my doc is amazing as well, and I have his full support of hygiene. So when he comes in, he absolutely reinforces everything I had just said, and it just creates a very trusting environment for the patient, which is excellent.
I am so happy you brought up the iTero scanners. I think they're like the greatest piece of technology ever. I think that provides so much value when you have them in the practice and you can actually show a patient as opposed to just explaining to them. It makes such a difference when you can see like this is actually what's going on in your mouth, and it definitely leads to treatment plan acceptance and all of that. Did you have anything else to add to that, Kendra?
I would add that a big part of my role is making sure that our doctors are receiving the same information that our hygienists are. So around the AAP guidelines and those sort of things, when new things come along in the world of hygiene, it doesn't always filter down to dentists as quickly as we would like. So they don't get the same opportunity to know what's happening in our world as we do. And so that's a big part of what I do, is just help facilitate making sure that the information and the forward thinking that's coming out within our profession is passed along to them so we can work collaboratively to continue to make it a success.
And I mean, I think everybody would agree that the relationship between the doctor and the hygienist is key within the office. I mean, you guys have to work together on everything to kind of run a cohesive practice. And it sounds like you guys all have that dynamic going within your offices. And staying on the within the office kind of topic here, can you guys tell us what your average day-to-day in the office is like? So kind of when you arrive, when you go home, about how many patients you're seeing and the most common procedures that seem to come up. And I think I might tie that into another question that came up here. Other than cleanings, what type of treatment do you provide? That might have been a lot, but Jennifer, would you like to start?
Sure. As far as the procedures we're providing, anything that's hygiene related. So yes, preventative prophies, but I work very close to the city and we do see a high rate of patients with periodontal infection that is active. So most often my day is filled with scaling and root planing treatment plans and patients. But as far as me personally, my day to day, I am the lead in a double hygiene scenario. So I work very closely with my associate hygienist. She is actually running the hygiene schedule most of the day. I'm there to support her and take whatever patient overflow we have. But I do a lot of the business end as far as running the schedule, ensuring our patients are confirmed. I handle most of the new patient exams, so I do a lot of the diagnoses. I am cleaning teeth as well, but in this scenario, we have a very big support system. To circle back a little bit on the procedures, so of course prophies, scaling and root planing, but we also do a lot of in-office whitening, and we will place sealants. That's pretty much our hygiene procedures, but just about anything you can think of, we're able to do.
So how many patients would you say you're seeing on average?
We are a very busy office. On average, as far as hygiene goes, we can see anywhere from 8 up to 14 patients a day. But again, there's 2 of us and we can handle that workload. Those are actual hygiene patients. As far as we do the diagnosis for new patients. So on any day in my office, I can come in, a new patient chair is always full. Most often they show up regularly. Of course, you have days where it just seems like nobody's coming to their appointments. But most often that's not the case. And we do see anywhere, I would say on average about, like I said, 8 up to 14 patients a day.
Abby, do you want to talk a little bit about your average day to day in your practice?
Yeah, so my day to day, I arrive to the office and we said, we have full control over our hygiene schedules. So I have built in like the first 30 minutes of my day where I have the opportunity to look at my hygiene business, and I look at my chart audits and my confirmation calls, and I have an opportunity to review my charts for tomorrow and review patients that are coming in to see doctor to look for any type of hygiene need that's there. Beyond that, I usually do see it depends on the day, if I have a second hygienist there or not. But when I have two hygienists there, I will have her schedule with anywhere from 7 to 8 patients. My schedule's totally dependent because similar to Jennifer, I keep my associate hygienist busy with a lot of our regular recare patients while I'm free to look at the business side, see new patients, make sure that I have availability to take care of those new patients, and to try to get their treatment started while they're in the office that day. So I am also there to kind of support my associate hygienist, and depends on the number of new patients we see that day, but anywhere from probably similar 8 to 14 patients, maybe more than that, depending on how many new patients are in the office that day or not. But
awesome. So we did have a follow-up question with that, which was, do you guys get to make your own schedule? And then another one was about how much time do you get for each patient? And I assume they want to know if that time is up to you guys as well. Abby, do you want to take that one?
I kind of missed the first question. What was it?
Do you make your own schedule?
I do work very closely with my office manager and my front office staff to make my schedule. I set clear guidelines for how I want my patients placed, what schedule and what column to be placing my recare patients in. And I do get the opportunity to kind of work my schedule from that point. If I see something that I'm going to need possibly more time on, or need to reschedule altogether for reasons X, Y, and Z, I do get to work with my front office team to rely on them to help make those phone calls for me if I'm not able to make the phone calls myself, to kind of work that schedule how I need it to be. Beyond that, you do, as a hygienist, get to set clinical preferences where you can establish how long you need for different types of procedures. If you're looking at just a prophy with, an exam, how long you'll need for that. And you can kind of even base that on how long it takes your doctor to get to your room for your exams. For your, bigger productions like, scaling and root planing, you might need longer than that, depending on if you're doing a full mouth on a perio patient, or if you're doing maybe just a quadrant or a half mouth. You can kind of set those clinical preferences for how you see fit, what your skill level is, and if you need longer, then that's totally within your right.
Yeah, so we definitely have quite a few students on this call who are currently in hygiene school. So I think time is definitely a big thing for them. I'm sure you guys remember you have a little bit of that like new grad anxiety when you're coming out of school and you're going to see your first like patients in a practice. So I think people just definitely want to know that they are going to have the amount of time and support when seeing their patients. And when you're fresh out of school, obviously you're not going to be as quick as you are as somebody who's been doing it. So I definitely think, like you said, having that autonomy and power over your schedule and the time it's going to take for you with your patients, I think that's so important that you have power over that. Jennifer, is there anything you wanted to add?
I mean, it's pretty much the same as what Abby said. The schedule really is like another one of my children. I have two children. I take the schedule very seriously. I am always ensuring that I schedule the appropriate amount of time for anything that I need or the other hygienist I'm working with needs. I have an excellent relationship with my office manager, who is a big point of support in your office. And our communication is wide open as far as my schedule and adding people on there and where they can go and how much time they need. We have a great system as far as that goes. And I'll even go so far as to say tomorrow is my son is 4, and tomorrow he's actually returning to preschool since the pandemic. And so it's his first day of school. And I'm coming to work a little late tomorrow so I can drop them off. And everybody's in support of that, and they allowed us to run the schedule that way. And I feel extremely supported as far as the amount of time that I need per patient, but also my work-life balance. I just never imagined it could be this way.
Mm-hmm. Well, congrats to your son. That's exciting. So moving on to a new topic here. We have, what is the pay structure like for a hygienist? And I think there was a follow-up a little bit with the guaranteed hours and the benefits. So Kendra, I feel like you're going to be the expert on this if you would like to go over compensation a little bit.
Sure. So one of the biggest things that comes up on any interview or any school visit is, are my hours guaranteed? Am I going to have to clock out if I don't have a patient? No, your hours are guaranteed. Your base pay is your base pay. We have some really great compensation packages around incentives and how all of that works. And I won't go into those details, but your hours are definitely guaranteed, and your base pay with a structure beyond that is definitely available. Not to mention the benefits, which is a huge thing. You just don't get that availability within dentist office regularly because they're small businesses. So it is something that is super important to me, and I always mention it. So hopefully that answers the question. Both of those there?
Yes, definitely. And Abby, did you have anything to add?
It's great, like Kendra said,
Yeah.
you don't have to clock out when you don't have a patient. We're a normal office. There's ebbs and flows. Sometimes, patients are, every single patient's there that day. Sometimes, I don't know where everybody's going. The weather's nice. So, maybe you have a no-show, and that's totally okay because you are still able to be on the clock doing other things and still getting your hours. You do have the opportunity for healthcare benefits, 401k, and kind of be incentivized that way too.
Mm-hmm. Yeah, I think the guaranteed hours are definitely huge. Jennifer, anything from you?
Yeah, I'll just reinforce what they're saying. Again, coming from private practice, I was in scenarios in the past where, oh, your patients aren't here, maybe take a punch out. And that's never really something I wanted to do. So it is really nice having guaranteed hours. And to just piggyback a little bit on what Abby said, there are days where sometimes your patients don't come in. It's going to happen in every dental practice in the world. It just happens. But the nicest thing about Aspen is that there usually are new patients, even if it's just a few. Those new patients do come in, and that creates opportunity to fill your schedule that same day. So if you have an opening, you can usually slide, hopefully that patient accepts treatment and slides right onto your schedule. And it just keeps the day flowing very nicely.
Wonderful. So moving on to a little bit of another topic here. I think we have a great panel for this question. We have two lead hygienists on here and someone who is a territory director. So bringing up the topic of mentorship, we do have, like I said before, a lot of students on this. So I know that's going to be something that's on their mind. So do you guys want to talk about our mentorship process, getting acclimated to Aspen, and basically what it's going to be like for someone who graduates and becomes an Aspen dental hygienist? Abby, since you kind of came right out of school, would you like to start off with this one?
Yeah, so not really my experience, but I have actually we've actually just hired a full-time associate hygienist, and she is a brand new graduate out of dental hygiene school. And I was actually very happy to have a brand new graduate on board because there's so many things that Aspen has set up for that mentorship. She's going to be doing her hygiene onboarding training online and in an office, kind of working with a trainer where she will get to watch videos, learn about Aspen, learn about our online program, you know, our EPMS, how we coordinate with, you know, our x-rays and their treatment plans and their charts and things like that. They'll get an opportunity to learn about all of the products that we use. They'll get an opportunity to meet other hygienists, kind of hone in their skills, ask the questions that they need to ask before they're even seeing patients, so that when they walk in on their first day, they have an idea of what the expectation is, kind of what the outline is, and what what Aspen is all about, really. As a brand new graduate, you're not going to walk in by yourself and not know where to go, what to do. You're going to have, you know, a trainer, you're going to have a lead hygienist to kind of hold your hand, for lack of better terms, and walk you through what your day is going to look like. Where even in my offices, we have our 2 hygiene operatories side by side. So I'm right there watching her all day long, and I can come in and step in and be like, you know, this is how you're going to schedule this, or this would be, you know, what the expectation is moving forward for this patient's treatment plan, and kind of guide her through that way, and make sure that I have her schedule set up how she needs to fit her clinical preferences as a new graduate, and kind of help her set up her schedule for the future based on what her, you know, time management is like as a new graduate.
Awesome. Thank you for that. And Jennifer, is there anything that you would like to add to that about mentorship?
Sure. Yeah, just a little bit of my personal experience. I started out as a brand new hygienist in private practice, and I really didn't have any mentorship. Of course, there were people in the office and everybody was nice, but there wasn't a specific hygienist for me to go to and ask questions and learn things. And truth be told here, when I graduated from school, I really needed a lot of help, and I was excited to start treatment, but I knew that I needed some experience. So specifically coming to Aspen, my onboarding experience was amazing. It was 2 full weeks of training. So even though I am an experienced hygienist, I was able to indulge myself in Aspen and learning about Aspen and how Aspen offices operate. And then we have a hygiene orientation program, which really taught me everything I needed to know about Aspen. So now in a double hygiene scenario where I do have an associate, she has only been practicing for 2 years, and she regularly tells me how happy she feels to be able to just hone in her actual hygiene skills. You know, she's learning the business and all of that stuff, but she's really allowed to take the time to properly remove calculus from teeth. And she tells me every day how how valuable this experience is. And I personally wish I would have been able to have something like that. I'm fine. I figured it out on my own, but I'm very happy to be able to provide that for hygienists.
Yeah, I mean, like both of you guys said, I think it's one of the huge benefits of working for an organization that can provide you that support that is like you said, pretty hard to get in a different setting. Kendra, working on the management side, anything you want to add with mentorship?
Yeah, for me, it is a little bit different because my support role comes into for these 2 ladies who understand our Aspen model and they understand their hygiene business and what's their next steps. So I get to work to help their territory managers of hygiene support and them work on what those next levels of leadership look like. What they can do within their office now, and then what those next steps will be to continue their growth within our organization.
I'm so happy you said that. That leads into our next question perfectly, which is what are the opportunities for growth as a hygienist? And does Aspen have any non-clinical positions for hygienists? Kendra, I think you would be the perfect person to kind of take this one. So if you want to go ahead, and I mean, you can just talk about your background.
Yeah, sure. We have, there are multi-levels of the clinical support to help the hygienists who are practicing. It takes all levels of us to make this work. But there are also things like recruiting and learning and development, opportunities that you just don't have outside of a DSO where where all the pieces of the business are coming together. So I do know personally multiple hygienists that have moved on to different parts of the organization, and it's just been one opportunity after the next. So additionally, a lot of opportunity has come out of the clear aligner part of our business, and our role as hygienist in what that is for patients. You know, our association does govern us in the regards that they say that we should be discussing occlusion, and so there's been a lot of opportunity for our hygienists around that as well.
And like I said before, both of our current hygienists on here are lead hygienists, so that is definitely a promotion. So Abby, is there anything that you would like to add about growth within Aspen Dental?
Yeah, I mean, I started out as a dental assistant, and when my hygiene license came through, I went to kind of a singular office as a hygienist, and then did some hygiene floating for coverage, and now, you know, then a hygiene associate and a hygiene lead. So I would say there's definitely been a growth in my career, and that's only, you know, been 2.5 years. So it really is set up for success, that, you know, you can always be looking for the next thing and trying to achieve the next thing. I still have personal goals for growth, and I'd love to see those opportunities come through. And, you know, Aspen really does have that set up, and there's always somebody above you who you can be asking those questions to, and who help you in your growth to give you the advice that you need. You know, what type of behaviors and what type of skills, you know, you can be working on to move into that next level of growth and leadership, and what kind of you want to see out of your career. You have the people in place to be able to ask those questions too.
And anything from you, Jennifer?
I feel like the growth within Aspen is exponential. I've only been there for a year, and I can't believe how we are continuing to grow. And as I said, me personally, I was hired as an associate, and I moved to a lead in a double hygiene scenario very quickly. Before my office even was seeing recall cases, we were in a double hygiene scenario. So things can change very quickly, and there is just so much opportunity for growth. Depending on where you would like to take your career, it's available.
Yeah, I mean, you guys both started out as associates, and now you both have an associate that you're helping mentor. So I think that's the definition of growth right there. And then Kendra, who started out as a hygienist and now oversees multiple hygienists within our company. So again, one of those benefits to working for a large organization, so much room for growth that you really just can't find in other settings. Okay, so one more question here, I think, before we will get into some of the COVID questions that I talked about before. Do you guys offer CE? If so, how much and what kinds, and who pays for it? So Kendra, would you like to talk about the CE that we have?
Sure. We have, it's an easy one. We have lots and lots of CE.
So much.
So much CE. So we have multiple partnerships with different organizations, Viva Learning, Dr. Bicuspid, to offer CE courses at no cost to our hygienist, or any of our clinicians for that matter, that are available. Both, they do the virtual settings where online credit is received, or virtual credits where live credit is received, interactive and online credits. So, and then in addition to that, many of us, one of the big things with the power of having behind a DSO is that we are certified to be able to offer multiple CE courses as well. So our hygienists have a plethora of opportunities on a variety of different subjects to be able to take CEs with.
So, I mean, would you guys agree, Jennifer, always CE provided for you? Always. I feel as though I used to struggle attempting to find CEs for myself. Sometimes based on finances, you know, you want to get you want to take those valuable classes, and sometimes they are expensive. So you are able within Aspen to take any class you could have ever imagined you wanted to, and it's covered as far as cost. So I feel like the CE is just always available. Granted, it has changed in the face of COVID, as Andrew was saying, but again, the virtual now counts for online credit, which is great.
Mm-hmm. And what about you, Abby?
Yeah, I hate to kind of like segue into COVID like a little too early, but during the quarantine when we were at home, I mean, Aspen really was offering so much communication and so many opportunities for CEs while we were home. So we really did feel like we weren't just kind of like dropped off at home and we were in this, you know, dark, scary place of the unknown. We still did have the support of the organization to provide us with, you know, CE courses, and we had daily, you know, schedules and opportunities. I mean, you could spend all day, you know, just like learning and connecting with hygienists and, you know, still being a part of, you know, Aspen Nation. And it really was helpful to have the CEs that were provided even during that time. So
Mm-hmm. Yeah, and I actually would like to touch on, I think Aspen actually is offering free CE to everyone during this time. So I will follow up after this with an email with the link to that, so you guys can go check out our virtual CE. I think everything is virtual right now, so Zoom is the most popular word in the universe. But so yes, we are offering free CE virtually for everybody, and again, I will send that link out to everybody who registered if you guys are interested. So following up on Abby's segue to COVID, we will get some of those questions. So have you had any shortage of PPE within your office throughout COVID? Jennifer, would you like to take that one?
Sure. We did not have shortage. There was definitely times where we wanted to order something specific and we couldn't get it due to manufacturing problems, but we were never without. And I know during my furlough, touching base with Aspen Nation regularly, I mean, they had constant meetings for us and phone calls for us to be on to update us on all the precautions that Aspen was taking across the country to keep us protected as well as patients for when we did return to the office. I have many friends who are hygienists and work in private practice, and they did not have the same scenario. Some of them were actually feeling unsafe returning to work for those reasons. We never experienced that, and we still aren't. We have what we need.
Mm-hmm. What about you, Abby, in your office?
we have never been in short supply of PPE. Similar to what Jennifer said, I mean, specific items. I mean, sometimes we're getting some, you know, real interesting items we've never would have ordered, but they still do the job and we still have the protective equipment that we need. As far as anything, I think, you know, Cavicide wipes themselves have been kind of in short supply everywhere, but we always have the Cavicide liquid available to us at all times by the jug, by the gallon, in never low supply. So we always have what we need as far as our N95 masks and ways to sanitize properly, and gowns and face shields. I mean, we've got our lunch lady bouffant caps and we've got our shoe covers, so we are set.
Mm-hmm. Yeah, and again, that is another huge benefit to working for an organization. We have partnerships with major companies like Henry Schein, for example, that provides these the PPE to our offices, and of course we're getting them in bulk as a large company. So again, it's a cheaper cost, and that is how our offices are getting those. And private practice may not have the ability to do so. Kendra, is there anything that you have to add?
I just definitely agree with you that coming, you know, a dental support organization, purchasing is definitely one of those support items. And there's a whole team constantly on the back end working to secure the best they can possibly get at the best prices for our dentist, and the most comfort for our teams. So just having those people on the backside working so hard to help us all makes a big difference.
Mm-hmm. So what types of protocols and policies have now been put in place in your practice to help protect you guys and help protect the patients as well? Would you like to start, Abby?
So every patient prior to their appointment during their confirmation process is asked a screening questionnaire regarding potential exposures, if they've traveled anywhere internationally, any family members or anyone that they've been in close contact with. We do pre-screen all of our patients before they arrive for their appointment to kind of rule out anything that may be a red flag, just kind of right off the bat. When patients arrive, they have their masks on in the lobby and they are getting temperatures taken as soon as they are checking in. And we are making sure that nobody is in the office who has symptoms, experiencing symptoms, has any temperatures or anything like that, and that they wear a mask at all times except for when they're directly getting treatment. So, and that goes for the staff and employees as well, as we are checking our temperatures, we are monitoring our symptoms and keeping close record of all of that.
Is that kind of the same for you within your office, Jennifer?
Yeah, it is. We've actually removed some chairs from our lobby just to keep social distancing measures in place. We do space out appointments for that reason as well. The goal is when a patient comes in, we have an operatory ready. We don't want to leave too many people sitting in one specific area. But yeah, exact same thing. The COVID questionnaire is asked to every patient that comes into the office. It's done on the phone as well before they come in. Everybody's temperature is taken, including staff. We actually change our clothes before we go home. We don't have too many people in the lunchroom together. I mean, we practice social distancing all day.
So were your offices able to stay open during COVID? I know that was definitely on a per state basis. There were definitely orders from governors in different cities, different states. Were you guys able to stay open, or was it just emergency procedures? Jennifer?
We were open. We never closed based on necessity. But hygiene, I was furloughed for about 7 weeks, like Abby had mentioned earlier. But the office did stay open during that time. And again, having hygienists in private practice, I had the opportunity to go back to work in a safe environment much faster than most of my friends did. And I was very happy for that opportunity.
What about your practice, Abby?
Our office did close to only see emergency patients as needed. So I was home on furlough, but again, just to touch on the opportunities for connection, being part of an organization, I mean, you never felt like you were out of the loop on what was going on, what was happening in your office, what, the guidelines were looking like as things were changing, constantly we were getting all the updates we needed constantly during that time, even during our closure. So we never felt like we were in the dark and not knowing what the future would look like. Prior to going back, we had, multiple CEs and conference calls and meetings as an organization, even to go through, questions and have open forums and things like that we needed to get the information across. And we did go back, we had the opportunity to go back sooner than a lot of private practices did, because our people who are in charge of ordering assembled teams and got all of our supplies together so quickly so that our offices could open, and that all of the staff had all of the PPE we needed to get back to work. And patients were in need. Patients were in pain. Patients needed work done during that time of COVID. So as soon as we were able to open our doors, we were able to allow that access to care.
So how did you feel working for a DSO benefited you during a time like this? I mean, going through a pandemic that nobody really saw coming. Abby, would you like to start?
Again, just with being part of such a large organization, I've met so many people. I've had opportunities to meet hygienists and doctors in multiple states. So I felt like I constantly had connection outside of just my little office, we all work together day in and day out and we know each other, but having the opportunity to also on a larger scale talk to people about, what's going on in your state, what's going on in your area, and how we all kind of really are connected in Aspen. And there's really not a sense of this is just, I'm a one tiny, person, but we're all really part of one big thing, and there's a lot of moving pieces, and you feel like you're a part of that when you have the connections that you do in such a large group. So
And what about you, Jennifer, the benefit of having a DSO to support you during a pandemic?
Yeah, it kind of goes back to what I was saying earlier, how safe I felt returning to work. And I totally attribute that to Aspen and the management team that I know was working tirelessly 24 hours a day, working around the clock to make sure that our offices were up and running for patients who needed them, and that practitioners, staff, and patients were all safe. This has been such an unprecedented time. Nobody knows what to expect. Nobody knew what to expect. Nobody knew how to react. So we had multiple phone calls during the time we were furloughed, updating us on the processes of getting us back into the office, the new protocols that were going to be in place. And I never once was hesitant to return to work. And I absolutely attribute that to working for Aspen.
Well, I completely agree with all of that. And I mean, Kendra, from the management side, what was kind of your perspective, and how did you handle all of the COVID stuff for the hygienists?
So I was right there side by side with them. We did a lot of CEs and learning and growing during that time. So I think they all spoke very well to us. It was a scary time because there were so many unknowns, and I feel like we all banded together, and our organization did do a good job of keeping us in the loop and abreast of what was happening. So I was very grateful for my Aspen family during that time.
Yeah, I think Kendra was one of the people that was working tirelessly to kind of make sure everything was going smoothly for all of our hygienists. So we thank you for that. And it is a little bit past the hour, so I like to end on this one question, especially when we have some students on here. So what advice do you guys have for our student hygienists on this call as they are graduating this year and going to be looking for jobs? Kendra, would you like to start?
Ask a lot of questions. Go into your office. Not every office is the same. Not even every Aspen office is the same. So really immerse yourself in the culture of the office and the people you're going to be working side by side with, and ask a lot of questions. That's okay. And anybody in the profession should be able to handle those and give you honest answers. So that would be my advice.
What about you, Abby?
My advice would be, if you're interested in a job, apply early. Go in even before you have, your hygiene licenses in place. You can set up observations, and you can start learning and watching and asking questions and getting the opportunity to, start working, like in my case, working as an assistant even before I had my hygiene license. There's a lot of opportunities to just kind of get your foot in the door and get some training under your belt and kind of see what it's all about and decide for yourself.
And Jennifer, what about you?
My best advice is be confident. I know you're just starting out, but school is very hard and you did it. And just know that you're going to be amazing in your career as well. So just be confident in your interviews. Ask questions. I can't reiterate that enough. Ask as many questions as you can think of. Don't feel bad for asking those questions. But you just apply everywhere you want and go with your gut. I feel like you learn a lot in interviews. You can grasp a lot from people, so follow your gut.
Yeah, and I mean, I think you guys kind of hit it with ask a lot of questions. And I think everyone is on here is kind of taking the first step by even joining this call. I think the huge thing is explore your options. You know, there are so many different things out there, whether it be private practice, Aspen, another DSO. You're going to find what works for you. There's something that's important to everybody, whether it be, you know, the benefits, the location, the mentorship. You're going to find that perfect fit for you. And the only way you're going to do that is by exploring those options and asking those questions. So I think you guys all had great advice for everybody on here. And with that being said, I think we will go ahead and kind of close this thing out. I really appreciate everybody joining in. If anyone has any last minute questions, the Q&A is right there. But thank you to all of our panelists for joining us tonight. You guys are all wonderful. Actually, wait, someone did just put someone in the Q&A. I think that's the first time that's happened at the end of this. Somebody really quick wants to know the equipment in the office. Do you guys get to pick what equipment you guys use? Jennifer, do you want to take that really quick?
I know the owner of my Aspen and the other Aspens, most of the offices are pretty standardly equipped, but it's all the technology you could imagine. I've never had this much technology available to me in an office, which is great. And I do have the opportunity for input and asking for something additional that I may want, and I'm able to get it.
Mm-hmm. Abigail, what about you?
Yeah, I mean, the equipment is generally standard. I mean, you will have a Cavitron, which is a really great feature that some offices still to this day may not have for their hygienists. So you will have a Cavitron in place. You do have access to other technology like the iTero, like oral cancer screening tools to help you with that. You will have digital x-ray, you know, computer charting and ways to view x-rays on your computer. And as a hygienist, you do have the access to kind of order your own supplies, and you can kind of pick, you know, the prophy paste you like, and, you know, a certain scaler that you might like, or a certain probe that you might like. You do have the opportunities to pick those things. So.
Mm-hmm. And Kendra, any last minute add-ons to equipment?
The only thing I would add with that is all of our offices are equipped with an advanced oral cancer screening device as well. So we have a few different variety of those throughout the different territories, but all offices do have that option for the hygienist to be able to do those adjunctive oral cancer screenings.
Mm-hmm. Yeah, and I mean, for me to add on, again, that's one of those things that goes with working for an organization and in the clinical autonomy that we talked about earlier. You guys do have all of this at your fingertips. I think there's like a Henry Schein catalog that you guys can go through and pick your equipment. And as hygienists, it's your business. So what you need, whatever is going to provide the best care to your patients, that's going to be up to you. And I do want you guys to know somebody wrote in the Q&A, thank you for answering the questions so in depth. So that was awesome. But again, thank you everybody for logging in. We hope that you guys enjoyed it. And thank you so much to our panelists. Everyone was so awesome. I will be following up with all of you guys, so you'll have my information, and I can definitely connect you. I'm sure all of these ladies would love to talk one-on-one if you have any more questions for the clinicians, so I can put you in contact with them. But like I said, you will get an email from me after, and if you want to talk any opportunities or have any more questions, I would love to go more in depth with you about that. So I hope that everyone enjoys their evening, and thank you. All right. Bye, everybody.
Bye. Thank you.
Mm-hmm. Bye, guys.